Welcome to Pharma Concepts Unleashed, your go-to channel for everything related to the pharmaceutical field. Whether you're a budding pharmacist or a seasoned professional, we've got you covered. From drug development to pharmacology basics, we break down complex concepts into easy-to-digest content. Join us as we explore the fascinating world of pharmaceuticals. Subscribe to our channel and hit the notification bell so you never miss an update. Let's embark on this educational journey together.
So we will continue to the next diagnosis and treatment of asthma. Already we have discussed about the types, definition, types, etiology, next pathogenesis of the asthma, next symptoms of the asthma. Now we have diagnosis and treatment of the asthma. Last topic from the asthma. So diagnosis and treatment of asthma. So how we can diagnose whether the person is having the asthma or not, and what is the treatment if the person is proven to be as an asthma patient. So what are the treatments for that asthma patient? So one by one we will see. First, diagnosis. So diagnosis is simple. First we will see the medical history. First thing in the diagnosis, so whether if a patient comes to you and he is having the you want to check whether the patient is having the asthma or not. He is telling that I have the first of all you will ask him about the symptoms, signs and symptoms. So this is the first primary thing you should ask to your patient. So first medical history. So you will ask about the signs and symptoms. So first the patient is asking, I have the consistent coughing more than 2 weeks. I have the consistent coughing. This is the one thing. Next, sometimes I have the chest tightness. It's angina attacks may come. Next, mucus production. I have more mucus production. Next, wheezing sound during the night. This may be the another. Next, seasonal asthma. Maybe he is having the symptoms of seasonal asthma. Maybe he is having the occupational asthma, allergic asthma. Different types of asthma in that symptoms will be there. If you recognize any one of the symptom, any particular symptom in that, so you can consider him as an asthma patient. Means you can consider, and after that you can prefer him to different tests. So this is the first medical history. You will come to know some idea. You will get some idea about the patient, whether the patient is facing this type of disorder or not, this type of disease or not. So you will get an idea about the signs and symptoms. So this medical history means signs and symptoms. So if any symptom related to the asthma, so you will consider him as an asthma patient, and we will go further details. So medical history. Next, spirometry. So next is the spirometry. In front of you is the spirometry. So as you know, all of you that in the spirometry we are going to check the lung capacity. So how much is the lung capacity? So there is a spirometer. So in our labs there will be the spirometer. So in that you are going to check the lung capacity. So how much you can exhale the air, how much you can inhale the air, how much is your capacity inside. So you are going to check through the spirometry. If it is coming under the normal, because already in the asthma patient excess mucus production will be there and bronchoconstriction will be there, so he will not be able to exhale that much air, he will not be able to inhale that much air. So he is having the shortness of breath, chest tightness during inhaling, exhaling. So he will be having the less tidal volume, respiratory reserve volume. So he is having the different very less these volumes. So the lung capacity will be less. So in the spirometry, in case of the spirometry, it will be different. So it will be like that. Next, PEF. So this is also a PEF. This is also a test. The respiratory flow. So in this PEF, peak expiratory flow. So next one is the peak expiratory flow. In this you are going to check the high speed. Means you are going to check the speed of the expiration. So maximum speed of the expiration. So in the PEF, peak expiratory flow, So first of all, medical history. Next, spirometry, you are going to check the lung capacities. Next, PEF, peak expiratory flow, you will check the maximum speed of the expiration. Means you will keep so in this instrument there is an instrument, peak expiratory flow instrument. So that is an oxygen mask, right? So you will kept on your the doctor will kept on your nose. So the whole mouth will be closer. So after that, this will be connected to the computer. So they will ask you to expire the air very forcefully. So first of all, you have to take the inspire. You have to inspire the air. So as much as you can inspire the air more and more. So when you inspire the air more and more, after that you have to forcefully expel all the air what you have inspired, and the reserved air also you have to expire. Means they will check the maximum speed of your expiration, whether he is having the excess mucus production. If excess mucus production, they will catch up he is having the asthma symptoms. So they will check the maximum speed of the expiration. So after that, in the computer there will be the production of it. There will be a graph like this. So a big graph will be there. So a hump like structure will be there. A big graph will be there that will show your speed of your expiration. So that will show the maximum speed of expiration. So this is the PEF, peak expiratory flow. Next, so allergy testing. So next will be allergy testing. So in the allergy testing, next one is the allergy testing. In the allergy testing, so some of your blood sample will be taken. So a prick is given to your hand or somewhere the blood is taken from the injections. So after that the blood is examined. Blood sample is taken, then it is examined under the microscope or anywhere we have to examine this for the presence of the allergen. Allergen. If there is any allergen present in our blood, so they will go further cases. So he may have the allergic asthma. So next, so allergic testing. Next, X-ray, especially chest X-ray. So everywhere you know that when the patient is having the consistent coughing since more than 2 weeks, so he may have the, so the doctor may consult him chest X-ray. In the chest X-ray, so if this is the airways, for example, I make a rough diagram. So if these are the airways, so these are the bronchioles. In the bronchioles, you see there are the lymph nodes will be here. So you see the bronchioles. So there will be a white spots will be here. More white spots. A big white spots will be here. A big white spots will be here. That will be the showing the mucus production. Excess mucus will be there. So in the chest X-ray will be there. Next, LFT. These are all lung function tests only. So LFTs, lung function test will be there. These are all lung function tests coming under there. So in the diagnosis, we take first medical history. So what is the medical history of the person? Means what are the symptoms of the patient? Whether the patient is having anyone from his parents may have the asthma. So there may be chances he may also get the asthma chances. So medical history will be first, means as per the symptoms, as per the genetics or heredity or from the parents he is having the asthma. Maybe he also get the chance of asthma. So medical history. Next, spirometry. In this you check the lung capacities. Next, PEF. You see the peak expiratory flow. You see the maximum speed of the expiration here. So you are going to expire the air with maximum speed. They will check the maximum expiration in the graph. They will show the maximum expiration. Is it coming under the control or lower to the control or lower to the normal level? So that will be the asthma chances. Next, allergy testing. So the doctor will, the lab technician will take your blood sample. So he will examine the presence of the allergens in the blood sample. So there may be also the chances of the asthma. Next, X-ray. So this is the common thing. So this is the first primary thing. So those are second primary thing. First will be the medical history. Next will be the chest X-ray. In the chest X-ray, they will be showing like this. So white spots will be there, more white spots will be there. That will be the production of, means more mucus will be secreted. So that will show the chest X-ray. So next is the treatment. So this is the diagnosis. Next treatment. So treatment will be brief. So for short term, so if a person is having the coughing since 7 days or 8 days, means he is not having that much of harsh acute asthma he is having. So the person can take the short term medication, so that will give him relief for some time, that will provide him relief. So short term medication will be there. So those are called, so we call them SABA, short acting beta agonists. We call them SABA, short acting beta agonists. Example include salbutamol. So what is the function of this salbutamol? This salbutamol acts as a, so this will relieve from the vasoconstriction. This will relieve the person from the vasoconstriction. In the asthma condition, the vasoconstriction will be there. So to provide the relief from the vasoconstriction, salbutamol is given. So this salbutamol is a short-acting beta agonist. Salbutamol. A syrup is there. So you know that a syrup is there whose name is written as the salbutamol. So remember that salbutamol is a short-acting beta agonist. So that will provide relief only for the shorter period. For the relief purpose only, the salbutamol will be given. So that is a short-acting beta agonist. So that will relieve you from the vasoconstriction, only from the vasoconstriction. If you have the chest tightness sometimes, if you have the consistent coughing, that will relieve you for some time only. That is the short-acting beta agonist. Salbutamol will be there. Next, long-acting beta agonist. If you want to give the relief to your consistent coughing or some of the symptoms of the asthma for the longer period, means a medication will be given. So those are the controlled release medication. You are taking the medication, that medication release its API, active pharmaceutical ingredient, very slowly. So maybe we are adding the polymers to that the medication will be coated with the polymer. So that polymer will tend to release the medication very slowly will be released, and it will give the relief for the longer period of time. And so those are called long-acting beta agonists. In the long-acting beta agonists, we have examples of salmeterol, formoterol, etc. Long-acting beta agonists include salmeterol, formoterol. Short-acting beta agonists include salbutamol, salmeterol, formoterol. Simple names. Next, if we see the Montelcast. So in the market, Montelcast is also available. So this is for the allergic asthma. Especially for the allergic asthma, the person who is having the allergy with some different things, dander will be there by roses, by taking the smell of the roses, by taking the smell of the perfumes, ether. So different types of smell when he is sneezing, when the different types of dander enter into his nostrils. So he is having the allergic symptoms. So for that allergic symptoms, Montelcast is mostly preferred. Montelcast. So this Montelcast are going to be reduced. IG production. It is going to reduce the IgE production, immunoglobulin E production. This Montelcast. So salbutamol, formoterol, Montelcast. So these are things will be given. Next, theophylline. Theophylline can be given. So theophylline will be given for the mild bronchoconstriction. Theophylline will be given. Next, I have written omalizumab. So we see some of the medications include salbutamol, salmeterol, formoterol, Montelcast. Next, omalizumab. Next, theophylline. So these are the medications. So we see first short-acting beta agonists for the short-term vasoconstriction, for the long-term vasoconstriction also. So salbutamol for the short constriction, short period of time. Salmeterol and formoterol for the long period of time. So these are the controlled release drugs. These release the drug controlled, means slowly due to polymer due to polymer formation, polymer complex formation. So next Montelcast will be given. Next omalizumab will be given. Next theophylline will be given. So these all drugs were given in a different proportion as per the symptoms the patient will be treated. So for a different period of time, so these medications are given. So this is the treatment of the asthma. So hope you understood well my topic, asthma. So we will meet in the next video. Thank you till then. Goodbye.